You're listening to Civic from the San Francisco Public Press. Health officials have been pushing for people to get vaccinated against COVID-19. Most in the city have, but some are still making up their minds. And community-based groups are reaching out to residents directly about vaccination to keep them as safe as possible.
I would say, hey, good afternoon, good evening. My name is Augustine or Augie. I'm a community health worker going door to door, just trying to get a sense of folks, what kind of resource or if you still need the vaccine.
I recommend people to go get it, but you're going to keep talking till you're blue.
And now people are starting to lose their jobs. So if you don't get the vaccine by certain dates, you're losing your job. And I'm like, how are you going to take care of your family, though?
I'm Laura Wennis, and this is Civic.
It's kind of nerve-wracking at times, because sometimes you get shooed away, or sometimes folks don't really want to have that conversation with you, so it's really hard, trying to find the actual message to approach different individuals.
This is Agustin Angel. He goes by Augie. He works with Bayview Hunters Point Community Advocates, where he's the youth program / community health worker outreach coordinator. He wears a lot of hats. But today, as on many days, he's out on a quiet residential street, about to walk up to a perfect stranger's door and introduce himself. Then he'll ask them if they're vaccinated. Here's how that might sound.
So, hey, good afternoon, depending on the day, and the resident that we approach. Every interaction is different. Sometimes you get some Latino person or Hispanic person that opens the door, so Spanish speaker, so you definitely have to alter and make sure that you're getting the terminology correct in Spanish, so that way it makes sense to you, yourself, and them. But every interaction is different. For example, for you, I would say, hey, good afternoon, good evening. My name is Augustine or Augie. I work with Bayview Hunters Point Community Advocates. I'm a community health worker going door to door, just trying to get a sense of folks, what kind of resource or if you still need the vaccine or any, trying to make sure that you're getting the proper testing locations or vaccine sites where you can access to. And they're, depending on how they react or if they want to continue that interaction with you, you can definitely ask them multiple questions. Sometimes you do get some folks that are willing to have a conversation with you and talk about the vaccine and why they have gotten it themselves and what vaccines and how did they affect them. We also had a few conversations with folks now that we're talking about boosters and supplemental shots. That's something that we have to have that conversation too. It's when are they eligible for them to go back and get vaccinated on that?
So what if I say, yeah, I don't know about this vaccine. I'm not sure about it. I'm still making up my mind.
With all respect, I'd say, can I ask you what's your decision on or what's holding you back? Is it what you don't know what's in the vaccine? Or is it because of all the information that you're hearing from your friends and family? Or is it the information that you're hearing from the media? What is it that's holding you back?
Augie has heard a variety of reasons. People are worried that the vaccine could magnetize them, or that it might affect their reproductive health. For the record, none of the vaccines have metals in them, and they don't contain any ingredients that could produce an electromagnetic field at the injection site, according to the CDC. It also says it's safe for people who are trying to get pregnant. But many, if not most, of the people whose doors Augie knocks on have already been vaccinated. Take Toya Beck, for instance. She came out to chat with me and Augie and new volunteer Jesus when she noticed us all standing around in front of her window.
I am fully vaccinated. I was working at the Moscone Center. So it took a long time for me to go and decide to get it because I've seen a lot of people have some reactions and stuff. But I eventually got it because my parents live across the street and they're elderly. Yeah. So they got the Modernas, but I got the Pfizer, and my 18-year-old daughter got it. Then I was thinking for my 13-year-old daughter, we took her to go get it. No reactions.
Oh, that's awesome.
My son and his girlfriend just recently got their first shots because I'm like, look, and my man got it. I'm like, everybody in the house is vaccinated. You need to go ahead and get it. So, they got it. So everybody in my household is. I talk to people around here, but, everybody got their own views on it. Don't want to get it. They don't know what's in it. You get the chicken pox, you get the shots from your babies. Nobody know what's in it. Everybody get those shots. So, everybody got their own views on it. But we got it, and we're good.
I was sick for a day and a half after I got mine.
I wasn't. The only thing we had, I'm a lefty, so I got it in my right arm. It was just a really sore arm the next day. I talked to a few people around here, and they like, oh, we're going to go get it, but they don't, so.
Why do you think that is?
I don't know. I have no idea. I know that my parents are in their 60s and 70s and they went and got it. So, and then I got aunties, and when I try to give them a hug, they like back up. But I'm like, damn, that's my auntie. But I understand where they're coming from. Nobody wants no hug and all that, still on my distance. So, yeah. I don't know.
People have their reasons.
Yeah, but I think it's better. Even if I did catch COVID, I have a better chance of surviving. I wouldn't be on the ventilator. And that's what people not looking at. And they're like, well, you can still get it. Yeah, you can still get it. I haven't caught it. None of us have caught it. Thank God for that. There's been some scares. My son was around somebody who caught it. And I'm like, oh, shoot. Like, that stopped all of us from going to work. So we had to go get tested. So, yeah.
That's good.
I recommend people to go get it, but, you're going to keep talking to you blue. So, to each his own. I don't know what to say.
Bayview Hunters Point is the neighborhood with one of the highest estimated vaccination rates in the city. According to health department data, 93% of people here have gotten their shots. And yet, this area consistently has had one of the highest rates of infection in the city. Local groups have been working to protect their communities, passing out PPE, connecting people to testing and to other resources. One of the people doing this work is Corey Munro, who also works with Bayview Hunters Point Community Advocates. And he says that very high vaccination rate is actually because of various organizations and agencies going out and doing this work. Take a drive around the neighborhood, and you can see the various vaccine and testing hubs that have been set up. But Corey also sees the fear and the mistrust of government, of media, of data. His outreach work is more focused on people who are unhoused than the door-to-door vaccine outreach that Augie does, but he has been talking with people about their feelings about the vaccine.
I mean, it's a split. Like in Bayview Hunters Point, it's a split. A lot of people have gotten their vaccines, which is great. Some people are trying to get their children vaccinated right now. So people believe in it, a lot believe in it, and then on the other half, a lot don't. Like they're totally against it, terrified against it, and for so many reasons, a lot of them because of history with black community. Some people talk about the Tuskegee incident. Some people feel like, society just trying to kill black people off, so they don't want to get the shot. But I've never seen the community so against something like this vaccine. So I don't know if it's because they feel like they're getting forced, why they just don't want to do it. Well, it's just like, man, they're trying to force us to do this, and we don't have to do this. And I've been watching YouTube, and I've been hearing these conspiracy theorists talk about why we don't need the vaccine. They trying to get us sick, and you see now they adding a booster shot, like they trying to train us, and they putting a chip in our body. So it's all kind of things that people are just so against it. It's just a big resistance. And I mean, even to the fact that we're losing people. But I do know when people get sick, they do change their mind and they want the shot because that's almost a near-death experience. But some people totally die. It's no coming back from death.
Lingering concerns or fears about the vaccine are not unique to Bayview Hunters Point, nor are they unique to a particular race. And this neighborhood is very racially diverse. There are specific historic examples that people of color, black people in particular, might cite as reasons to be very cautious of promises made by the government and health officials, like the Tuskegee study, in which people infected with syphilis were left untreated and observed to learn about the effects of the disease. That doesn't mean this is necessarily a good predictor of who is most or least likely to have been vaccinated in San Francisco. In fact, city data shows it's white people who are the least vaccinated, at 69%. 71% of people who identified as Black or African American have been vaccinated, 81% of Asian people, and 84% of Hispanic or Latino identifying people have gotten shots.
We've been talking a little bit about the factor of racism and fear and, the black community and the history of Tuskegee and all that stuff. But is it actually, from what you're seeing, you do outreach, you talk to people, is it actually more pronounced among one racial group than another, or is this kind of across the board?
I think it's across the board. I mean, there are people, Muni, the police, the fire department, BART. You have people saying they just not getting the vaccine. They're ready to lose their jobs. It's deep.
That's true. According to the San Francisco Chronicle, more than 100 Muni operators may be fired by the time the city's vaccine mandate is enforced on November 1st. Almost all of the 36,000 or so employees of the city of San Francisco are vaccinated. But it's not quite all, and there are workers in the transportation agency, in the police department, in the fire department, and even in the health department who haven't been vaccinated.
So it's bigger than just a black thing, it's just deep. I think on the black community, it's always a little overhyped because a lot of times people want to say, hey, well, the black people said this and that, but this is across the board on this situation. And I feel like, I grew up in Bayview Hunters Point and the black community, so I feel like we always get a bad rap, like everything bad. Well, we got a lot of great things going good in our community all the time. Like I'm out there every day passing out food on the back streets, but we have a lot of great things coming along Hunters Point. So I think sometimes whatever is something negative, people will just push it on the black community where, things do go on, but a lot of times there's some great things going on in the black community. But this COVID and this getting the vaccine, it's a nationwide thing. It's not just the black community who's saying they don't want it. It's across town, all across town.
That said, in the last 2 months, Bayview Hunters Point has had 511 new cases of COVID recorded, according to the health department. That's the highest case rate among San Francisco neighborhoods, even with the highest reported vaccination rates. Corey is keeping an eye on those case rates, but he's also keeping an eye on the narrative that can emerge when the focus is only on the negative.
I feel like when COVID first hit, me and some friends was like, watch they blame it on the black people. Like when it first hit, we like, watch, somehow we gonna get the blame for this COVID stuff. And we knew it, and then I was reading the newspaper one day and it was like, COVID, just like they showed the whole San Francisco and it was like Hunters Point, the worst part of the city. I'm like, all right, it was even like, oh, everybody's hanging out in Hunters Point, but I'm like, they're hanging out in the Presidio and congregating there. So a lot of times we feel like whenever it's bad news, we're going to get the rap. So I think sometimes what reporting is just a lot of stereotype, and people need to come out and get to know the people. It's like you came to talk to me, you know what I mean? The good thing is it's a lot of people that help. Like we got a lot of people who reach out and help. We have so many different agencies that's reaching out and helping during the COVID like never before. You have people who are helping out with the homeless. But I feel like if somebody say, hey, they're congregating in the black community or the brown community, it was congregating in the white community too. Like I've seen it, it was just all over.
Fort Mason.
Yeah. So it happens everywhere. But we're so used to getting the blame for everything that we whatever, but it is frustrating. We in real life, if you come over here, you see this stuff. Because we have a lot of people who are concerned. For a long time, the black community was in the house, real talk. It was a ghost town. When COVID started, you would go around and wouldn't see literally nobody. It was scary. You could see a tumbleweed roll down the street. Everybody was in the house. I've witnessed it myself when I had to go out and get certain things. I'm like, damn, where is everybody? And they was in the house. They was terrified. So a lot of the reporting to be like, oh, they all congregate. No. People started coming out when they were saying come out. Because it was so much, okay, you can come out. Now go back in. And I think once they said go back outside, people were just so tired of being on the inside. So it was hard to get them back in. Then we got to take your mask off, put your mask back on. There's so much misinformation we go on. Yeah. And you turn on the channel and the news, we're not wearing masks. And you see white people say this, you see black people say this, and you watching the news. So people were so confused because the country was split. And that was a big, big problem. Who to believe, right? You watch the news at 8, wear your mask. Turn it on at 6, take your mask off. So who do you believe? You know what I mean?
We'll get back to this story and to that question in just a moment. You've been listening to Civic from the San Francisco Public Press. And real quick, while we're on break, I have a podcast suggestion for you. It's a science/science fiction show called Our Opinions Are Correct. It's hosted by 2 local writers, Charlie Jane Anders, the award-winning author of several science fiction novels, including recently released Victories Greater Than Death, and Annalee Newitz, an award-winning science journalist who writes for the New York Times and The Atlantic. It comes out every other week, and they've talked about all kinds of things, from the death of the universe to writing fight scenes. Join them as they expand minds and befriend cosmic monsters by looking up Our Opinions Are Correct wherever you listen to podcasts. Let's get back to our story about vaccine outreach and the question Corey just posed. With all this different information and misinformation flying around, who do you believe? Well, some people will believe the outreach workers who are making a specific effort to get to know them, or whom they already know. I asked Corey what he tells people when he hears they're not planning to get vaccinated.
What goes through your mind when someone tells you, I'm not doing it?
I always trying to get them to understand that, what about your family, right? We still have grandmothers around, mothers, fathers, grandparents. So I'm like, okay, say you catch COVID and you give it to them and they die, or some kid catches it. Like, I think we should be more concerned about spreading it. Like, and people don't understand that they might die if they catch it, they might not. But what if you spread it to somebody and you kill somebody in your family? Like, how would you feel? So that raises an eyebrow. That raises some concerns, but a lot of time they just real skeptical about it. But I really try to make them think about their family members who we could spread it to and do some real damage to, and family members who we really need. We need our mothers in the community. We need our elders. We need our fathers. So I always try to get them to think about the people if you do catch it and you're around and then they catch it and something happens.
And, what if you die, right? Like, what are you going to leave behind?
Yeah. Well, I mean, a lot of people don't want to die at this age. They think about it, but it's still that resistance. It's that resistance that, no, they trying to shove us down our throat. And look at this booster shot. They're going to be giving us these shots over and over again. But another thing is like, man, we got shots when we were children, right? And I'm like, if you go to the hospital for anything, high blood pressure, anything, and you go in the emergency, they sticking a bunch of IVs and things in you. You don't know what's going in you then, right? We're eating all this meat and different things, the cow, the chicken, the pig, everything. They're getting vaccinated and they have shots that's going inside of them. We eating all of that. No question asked about that. So I just try to challenge the mind about the whole process. I mean, people smoking all kind of different weeds these days, right? So, hey, you don't know what the hell's in there either. So just try to get people to think about what's going on. But it's just this vaccine that really has people, they're really bugging out.
Where the hell did this come from? I mean, of all the things, why this vaccine? Why are we so skeptical about this?
I think it's from the top, right? I think it started all with the Trump administration and just saying, hey, they pretty much was against the vaccine, and then the propaganda that's been going on the news, because if you watch CNN, MSNBC, they're saying get it. If you watch Fox, they're saying don't get it. Some people just naturally don't believe in vaccines. I worked in the school district for 22 years, and a lot of people believe in getting their children shots, and a lot of people don't. We had children catch like chicken pox and didn't have to, and parents like, whoa, but they didn't want to get the vaccine. So a lot of people are totally against it. Religion, like a lot of times when people are into their religions and strong into their belief system, I mean, sometimes they're taught not to put things inside their body and God will handle everything. I mean, I'm a spiritual person too, but I believe in my health, and I kind of believe doctors, and they doctors have, been to school and all that. But I do also understand that with racism, people are afraid, right? Like, they might be afraid, well, what if doctor don't like me as racism? But I'm like, there's black doctors, there's Latin doctors, there's Asian doctors, there's all kind of doctors in different fields that you could go to. Like, I feel if you're afraid to get a shot from a white doctor, you could go to Dr. Rose, she black. So, I mean, I just feel like it's certain ways you could go about getting a vaccine. And I don't necessarily think like a white doctor will kill you off. There are people who could give you the vaccine that you trust. I've never seen it like this before. It is really interesting. And it feel like it's more and more of a pushback. And now people are starting to lose their jobs. So if you don't get the vaccine by certain dates, you're losing your job. And I'm like, how you gonna take care of your family though? I'm talking about some nice high-paying jobs. People been in jobs for a long time, and that's a concern. Like, I mean, I get everybody wants to, hey, I'm gonna go start my own business, but sometimes all businesses don't work out, or you don't make money at the beginning. So you have overhead, taking care of your house, car notes, and all of those stuff. So it's real interesting. But at the same time, a lot of people have been out of work and they had a vaccine, so a lot of people will be able to get these jobs. So it's a flip of the coin.
Some people might also believe doctors, like Dr. Kim Rhodes, who work with groups that have deep roots in the community, like Umoja Health. This is part of what the outreach workers do, offer to connect people with information from trusted sources. That requires making those connections in the first place, finding those people who need information. They do this in a targeted and strategic way, as I learned while I was shadowing Augie and his trainee Jesus.
So I'll be the face of the door, so that way you can get a sense of how we do outreach and the messaging of when we approach folks. Okay.
Remember how I said that Bayview Hunters Point has one of the city's highest overall rates of vaccination, but also one of the highest case rates? Well, as one of my colleagues recently reported in the San Francisco Public Press, the health department thinks that might be because looking at the neighborhood in aggregate isn't specific enough. If you zoom in, there are certain pockets, individual census tracts, that have much lower vaccination rates than the neighborhood or city overall.
How do you figure out where to go?
We kind of try to go based off the census tract, trying to get us a hold of all where the areas that are at least unvaccinated spots and neighborhoods. So once we figure that out, obviously we know that the census tract is not very accurate or up to date, just due to multiple families living in one household or renting out like part of their other rooms, So it's definitely by approaching the door-to-door outreach or going door-to-door canvassing definitely does help out by us and getting a sense of where residents are and if they're fully vaccinated or not vaccinated and where to go if they still have questions regarding the vaccines, and give them the directions of where to go for those to have those conversations with an expert.
Until recently, the city wasn't sharing census-level vaccine data with groups like Bayview Hunters Point community advocates. But the city's data is also imperfect because people's living situations may not be precisely captured by official tallies. For example, there's a lot of families living in RVs and other makeshift housing. Some families are growing. Augie and Corey know one family living in a vehicle that recently welcomed a baby. Outreach workers are carefully tabulating the information that they gather as they're going door to door.
Once we leave, we have a pre-assessment survey, just trying to figure out what area location we went to, what door we knocked, the day of our outreach, if the resident or the household has received a COVID-19 vaccine, if the rest of their household is vaccinated. Is someone currently, or do you currently live with someone who's pregnant and hasn't been vaccinated? Or, do we want to make sure that we take these into consideration? Or is anyone in your household interested in getting vaccines so that way we can come back and provide vaccines to them?
Augie's work means he's talking to people about coronavirus, how to avoid getting it, and what to do to keep your loved ones safe and get yourself through it if you do fall ill. And just recently, Augie himself learned the hard way just how important those resources are.
You had your own experience with what can happen, how you can be vaccinated and then still get COVID. So what was that like for you, finding out that you had it and then the experience of actually having to go through COVID?
Yeah, it was definitely a horrified experience. I mean, I thought I was the flu, at first. It could have been anywhere where I got it due to the work that I do. I'm always in the community. It could have been when I'm in the community or when I was out and about. But yeah, at first I thought it was flu symptoms, but after that, the next day I want to go get tested. But it's just waiting, the fear of waiting and the anxiety that you get when you don't know if you're positive. So you still have to still take care of yourself, but at the same time you want to make sure that you're not spreading or being contagious to anyone else. So those are the things that I was kind of scared and freaking out myself. Just what do I do? What resources can I get? What medicine or approaches do I take? Is it okay if I could take this medicine? Is it not okay? So it's at times I was kind of lost in what to do. And it's crazy because I'm out here working with this community and doing all these COVID outreach information, but it's just we don't have these conversations with our residents, and that's something that I want to bring up too. It's to have those conversations of what to take when you do test positive. And for example, what's the turnaround of those tests that you do get back? It's how long do you have to wait to get your test results back? And then while you're waiting, you still need to go get groceries. You still need to get all these medicines. You still need to take care of yourself. So it's you're still out in the community without knowing your test results. And that's one of the things that kind of put me in a surprise until my test results came in. They said they were positive. That's when I was well, I need to shelter myself in place. Those couple of days that I didn't know, just trying to make sure that I was protecting myself and not protecting everyone else by double masking, meeting every requirements and guidelines.
He made it through and was cleared to return to work. But he encountered one unpleasant surprise. All those resources he's guiding people to, he couldn't access them.
Since I don't live in San Francisco, I was not allowed to access those resources or wraparound services as a person who works in San Francisco. So I didn't know what to do or go about it with my own county. You know, coming from San Mateo, Daly City County, it's definitely, they want us to, even with the San Francisco, they want us to call this number to let them know that we tested positive. But why do we have to call them to let them know that we're positive when they already know? They should be calling us to let us know, okay, this is where you need to go. This is the resources that you can get provided, instead of us calling an answering machine and waiting 24 hours till the next day to get a phone call back, and then hearing to find out, oh, you can't access these resources because you don't live in the county. So you have to go through San Mateo County. And now it's like going to a different county. It's like, now what is really available to me, and now I have to go do my own research to these. So it's like, we want to make sure when we're having these conversations in door-to-door, doing door-to-door outreach, that these residents are aware where to go for these resources as well.
Outreach workers like Augie and Corey are in this for the long haul, because the coronavirus isn't likely to be going away anytime soon.
When will you say, all right, we've succeeded, we don't have to do vaccine outreach anymore?
Never. I think this is going to be for a while. It's like the flu, right? The flu ain't never went away. I just feel like it's another version, not another version of the flu, but it's COVID, but it's probably a yearly thing. Prayerfully, no, but I mean, I think it's here to stay, and it's serious, and we have to take it serious, especially if you're not in the, even the best of shape is tearing people up. So I just think we have to be aware. We have to keep the message going. Yeah, we have to remain to be safe and keep the message going.
I'm Laura Wennis, and you've been listening to Civic. Civic comes to you from KSFP LP at 102.5 FM in San Francisco. Our theme music is by John Dillon. Our team includes producer and contributor Mel Baker and assistant producer Liana Wilcox. KSFP is a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find our reporting at sfpublicpress.org. Our staff here includes publisher Lila LaHood, executive director Michael Stoll, assistant editor Noah Arroyo, copy chief Kurt Aguilar, photojournalist and reporter Jessica Prado, and reporter Nula Bashari. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes every Thursday. Thanks for listening.